Is Botox really useful in dentistry? I have an expert on it. Chris Howell, one of our scientists. Chris, thanks for being with us today.
Good to be here.
I have just a little prelude to get you thinking. Everybody wants to look better, feel younger, feel better about themselves, have higher self-esteem. You know that. Can you contribute to it? Yeah, because all they see is your face. All they see is your face. If I put my hands behind my back, you can't see anything on the rest of my body. Well, are there therapeutic reasons? Yeah, there's a masseter injection, and that slows down bruxism. There's an aesthetic reason where those little lines are going to get fixed up.
Mm-hmm.
And look at this one where a little injection in that upper lip made it hang low for a while.
Drop it down for that gummy smile.
Yeah, I think so. Well, Chris, you've been working around this a long time. Tell us how you feel. You've got several purposeful things for Botox. Tell them about it.
Well, there's four primary uses for Botox in dentistry today: TMJD, mesenteric hypertrophy, like you showed in that picture there, to get that masseter to relax a little bit. Bruxism, and then of course hypersalivation are the three. And then there are numerous cosmetic uses as well.
Profound. And now the controversy over whether dentists should be doing this, I want you to think about 1 millisecond. Who uses small needles? Dentists. Are they smaller than a 330? Yeah, they're a smaller needle. Are they painful? No, done properly. Is there a major problem with risks? What do you say?
Well, it's actually very low risk. Counterindications for it are pregnancy, lactating, breastfeeding, etc., neuromuscular disorders, and then infections at the injection site. So and then on top of that, the nice thing about it is, if the effects aren't what you like, they typically go away within 4 to 6 months. So they're typically, it's very hard to do, what we would say permanent damage with it. When we get into fillers and things like that, that's a little bit more permanent, becomes a little bit more dangerous. But with proper training, absolutely, this is within a dentist's wheelhouse to do.
Well,
no doubt. You
get on a cruise ship, you see some young kid there squirting Botox, and all of a sudden dentists who have more knowledge of facial anatomy and needles than any other specialty in all of medicine. It's very legitimate, and most states and provinces allow it, but be sure you check.
Absolutely. That's definitely, you need to check with your State Dental Practice Act as well as other local laws to make sure that you're within compliance in terms of your training and certification to do it. Absolutely.
There are turf problems out there. I don't even have to mention the groups that would like to have this all to themselves. Yet, who deals with the face more than we do? Plastic surgeons occasionally, but they don't even deal with it constantly. We do every day of our existence.
Well, I think for patients, a lot of it has to do with trust. I know my dentist very well. If I were to go in and see a plastic surgeon, odds are it would be the first time I saw them. So I would be a lot more apt to trust my dentist, especially if he's a good dentist, to do this than I would an unknown doctor.
You're sounding very positive. Do you have any real limitations in your mind?
Outside of the training aspect of it, no. It's one of those things that I think dentists could pick up fairly easily and would be a nice income generator for their practice.
There are organizations that will be pleased to help you. The American Dental Association is very cognizant of this and promotes it, has people giving courses on it. So look into it. It's another major thing to keep your brain on and keep you stimulated.
Absolutely.
And to get particularly your female patients, feeling much better about themselves. We all have lines and miscellaneous challenges. I could get rid of those nasolabial folds about like that if I wanted to.
Well, and I wouldn't just go with the females. I'm hitting that 51 years old age myself, and I'm not gonna lie, I was very tempted when I was doing this research to have it done on myself. So it's definitely something that would be appealing to both men and women, and like I said, I think it would be a very nice addition to any practice.
look into it. We have videos on it. There are many people who will be glad to help you. It's another thing to keep you in line with the current trends. Thanks, Chris, for being with us today. Thanks for being with us. Join us next week.